If you're dealing with persistent pain from a sports injury, chronic tendonitis, or even arthritis, you know the frustration of relying on ice packs, painkillers, and just waiting it out. Traditional approaches often focus on masking the pain or simply managing the swelling. But what if you can use a tool that works on the cellular level to accelerate your body's own natural healing process? What if you could flip a biological switch to reduce inflammation and speed up recovery? That tool is cold laser therapy, also known as low-level laser therapy. Some people call it LLLT or photobiomodulation therapy. Despite the space-age name, it's not invasive. The drug-free treatment is backed by robust science studies. It doesn't generate heat, it doesn't hurt, and it doesn't involve surgery. Instead, it harnesses the power of specific wavelengths of light to target damaged tissue and kickstart repair. This guide will give you a clear, no-nonsense explanation of the science behind cold laser therapy, exactly how it stimulates healing, and its critical role in resolving stubborn musculoskeletal pain. To understand cold laser therapy, you need to think small, all the way down to your cells. Every cell in your body has tiny power plants called the mitochondria. These mitochondria are responsible for producing ATP, adenosine triphosphate, which is the basic energy currency for all cellular function, including repair and regeneration. When a tissue is injured or chronically inflamed, the cells in that area become stressed, and their mitochondria cannot produce enough ATP to properly heal. Healing stalls and pain persists. Cold laser therapy works by applying specific wavelengths of light, typically in the red and near-infrared spectrum, around 600 nanometers to 1,000 nanometers, directly to the skin over the damaged area. The cold designation means the laser does not heat the tissue. The light is absorbed by the cells without causing a thermal effect. The key scientific mechanism is that the light energy is absorbed by the receptor inside the mitochondria called the cytochrome C oxidase. Think of cytochrome C oxidase as the solar panel of a cell's power plant. When it absorbs that laser light, it is stimulated, which dramatically increases the rate of ATP production. This is the cellular energy boost. By flooding injured cells with increased energy, the laser gives the tissue the fuel it needs to jumpstart the stall, healing, and repair process. It takes cells that is running on empty and puts them back into higher gear. The surge of cellular energy from laser light triggers three major therapeutic actions in the tissue that directly combats pain, speed up recovery in musculoskeletal injuries. The first action is reducing inflammation and swelling. Inflammation is the body's natural response to injury, but chronic unresolved inflammation causes ongoing pain and further damage. That works to decrease the production of pro-inflammatory enzymes and increase the activity of anti-inflammatory cells. This rapid reduction in swelling and inflammation directly relieves mechanical pressure on pain receptors and allows blood flow to return to the area, creating a less hostile environment for healing. The second action is pain relief through neurological effect. The cold laser directly influences nerve conduction and nerve sensitivity. By reducing inflammation, the laser lessens the chemical irritation around the nerve surroundings. Furthermore, the energy helps normalize the transition of pain signals, which has an immediate analgesic effect. Patients often report a significant decrease in pain within minutes of the treatment, allowing them to participate more effectively in physical rehabilitation without the reliance on prescription pain medications and shots. The third and most crucial action is accelerating repair and regeneration. With the massive increase in cellular energy, the cells can now perform their restorative duties more efficiently. The laser promotes the production of collagen, which is the building block of tendons, ligaments, and muscles. It speeds up the formation of capillaries, tiny blood vessels within the damaged tissue, further improving oxygen and nutrient delivery to the area. This is why laser therapy is not just a temporary fix. It actively facilitates the structural repair of the damaged tissue. Laser therapy has a wide range of clinical applications for non-surgical pain relief, particularly in conditions where tissue healing is slow or inflammation is chronic. It is frequently used to support recovery from acute injuries, manage long-standing chronic pain on top of other diseases. Common conditions where laser therapy provides significant support include tendonitis, tendinopathy such as Achilles, rotator cuff, and patella tendon issues by promoting collagen repair. Plantar fasciitis is huge by reducing chronic inflammation in the fascia. Then you have carpal tunnel syndrome and other nerve entrapments by reducing swelling around the nerve, and chronic conditions like osteoarthritis, rheumatoid arthritis by managing joint inflammation and pain. It is also used extensively for muscle spasms, joint sprains, and most surgical and post-surgical incisions to accelerate wound healing and minimize scar tissue formation. What should you expect during a session? A cold laser session is quick, safe, and completely painless. The practitioner will position the device directly over the area of injury. You will not feel any heat or vibration, only the light on your skin. The duration of the treatment typically lasts anywhere from 10 to 15 minutes, depending on the size of the area, the depth of the target area. There are no side effects or downtime, allowing you to return to work or activity immediately. The clinical results are usually cumulative, meaning a treatment plan typically involves a series of 6 to 12 sessions to achieve the full restorative effect. The key to resolving chronic musculoskeletal pain is to move beyond temporary fixes and address the problem at its core, the stalled healing and inflammation at the cellular level. Cold laser therapy offers a powerful, non-invasive way to do exactly that. By giving your cells the necessary energy boost, you are optimizing the body's innate ability to heal, repair, regenerate, and recover. If you're ready to shift from simply managing your pain to actively accelerating your healing, it's time to explore the scientific advantage of cold laser therapy. Don't let cellular fatigue dictate your recovery. Click the link below to schedule a professional evaluation. We will determine if cold laser therapy is the right non-invasive tool to reboot your healing, reduce your inflammation, and get you back to living pain-free again.